Hi, so right now, today, we're going to talk about measuring VO2 Max. This is the most common fitness assessment that there is out there. This is really important to determine someone's health status. Someone's VO2 Max can predict their risk for cardiovascular issues or even all-cause mortality. That's the health side of it. From a fitness athletic side of things, VO2 Max can predict success in a lot of athletic events, ranging from 3-minute cardiovascular events to marathons and those kind of things. It can be used as a tool, a training tool, to see where your client should train. What's the, I don't know if you've heard of their lactate threshold or their ventilation threshold, which we'll talk about. If you can know where that threshold is, and you can train your client right under that threshold, that is the greatest intensity that they could train at without reaching or hitting that wall. Okay, so right now we're going to talk about how to set a client up to prepare and to perform a VO2 Max, and then you'll get to see Curtis, who's on our treadmill, actually perform the VO2 Max to see what that's like. So the first thing that we want to do, I want to talk briefly about the equipment that we're using to measure this. So Curtis is hooked up to a mask. This is, can you turn around, Curtis? This mask has a valve in the front of it, which is we call it a two-way, non-rebreathing valve. And what that does is it allows Curtis to breathe in the air from the outside atmosphere. And as he exhales, none of that air escapes outside the mask. All of it is collected into this tube and it goes down into the machine. What the machine will then do is it will analyze and say, okay, out of what Curtis is expiring, how much of that is oxygen? Okay, so that's how it's telling us what his oxygen consumption is. Okay, what we need to be monitoring during this assessment is his heart rate. Okay, we want to watch our client's heart rate. We want to watch their, what we call a rating of perceived exertion. What this is, and this is used very commonly when this kind of assessment is done. With the mask on, I can't understand, I can't communicate very well with the client. So what we do is every minute I'll hold this sign in front of him and I'll say, how do you feel? And they just point. If they point to 6, that's indicative of what Curtis is doing now, nothing. Okay, as the test is going, obviously they'll increase, and 20 would be completely maximum exercise. Okay, maximum effort. And that lets me know, okay, he's about done, or he's got a little bit more left in him. The other thing that we would want to monitor, especially if you have a client that's not an athlete, a client that might be a little bit older, you want to monitor blood pressure. Today we're not going to monitor blood pressure, but that is something that you really want to be aware of. There is a lot of different kinds of tests that you can do. Today we're doing a treadmill test. If you were to monitor blood pressure, you would probably want to do a bike test, because it's really hard to get someone's blood pressure when their arms are pumping up and down. Okay, for someone who's an athlete, probably not that important. Okay, so we're monitoring heart rate, we're monitoring their RPE, you might want to get blood pressure, and then on the screen here, which I'll talk about more in depth a little bit later, it shows real-time his oxygen consumption, his ventilation, his what we call respiratory exchange ratio. So that tells us what he is burning for fuel. Is he burning carbs? Is he burning fat? And we would expect, as Curtis starts to reach max, that he's going to be burning more and more carbohydrates. So we watch those things to let us know that our client is responding the way that he should. We want to make sure that there's not going to be any health problems during this kind of assessment. Okay, so what we're going to do first is I'm going to get Curtis started on a little warm-up. So go ahead, Curtis, I'm going to get you at about 2.5 miles an hour at a 3% grade. Okay, so Curtis, this is going to be his warm-up. The protocol that we're utilizing today is a ramp protocol. What that means is every minute we're going to increase the speed and we're going to increase the grade until he's done, until he can't go anymore. Okay, so it's really my job as the personal trainer to be there with him, especially when this gets hard, to push him, go harder, push it harder. To get a true VO2 max, you need that, the subject or the client needs that outside hurrah, that outside cheerleading effect to push him to go as far as he can, okay? So I'm going to give my attention to Curtis to make sure that everything is going okay with him.